Let us begin. Urea cycle. What is the primary function of the urea cycle? The primary function of the urea cycle is to eliminate toxic ammonia from the body. Which organ is primarily responsible for the urea cycle? The liver is primarily responsible for the urea cycle. What is the first step in the urea cycle? The first step in the urea cycle is the conversion of ammonia to carbamyl phosphate. Which enzyme catalyzes the conversion of ammonia to carbamyl phosphate? The enzyme CPS1 carbamyl phosphate synthase 1 catalyzes the conversion of ammonia to carbamyl phosphate. What is the intermediate product formed after carbamyl phosphate? The intermediate product formed after carbamyl phosphate is citrulline. Which enzyme converts citrulline to arginosuccinate? The enzyme ASS arginosuccinate synthetase converts citrulline to arginosuccinate. What is the final product of the urea cycle? The final product of the urea cycle is urea. Which enzyme converts arginosuccinate to arginine? The enzyme arginosuccinate lyase converts arginosuccinate to arginine. What enzyme is responsible for conversion of arginine to urea? The enzyme arginase converts arginine to urea. How is urea eliminated from the body? Urea is eliminated from the body through the kidneys in the urine. What happens to excess ammonia if the urea cycle is impaired? Excess ammonia can accumulate in the body, leading to hyperammonemia and neurotoxicity. What is the most common inherited disorder of the urea cycle? The most common inherited disorder of the urea cycle is ornithine transcarbamylase deficiency. What is the inheritance pattern of OTC deficiency? OTC deficiency is an X-linked recessive disorder. What are the symptoms of OTC deficiency? Symptoms of OTC deficiency include vomiting, lethargy, seizures, and intellectual disability. How can OTC deficiency be diagnosed? OTC deficiency can be diagnosed through blood tests that measure ammonia levels and specific amino acids. What is the treatment for OTC deficiency? Treatment for OTC deficiency involves a low-protein diet, medications to remove ammonia, and in severe cases, liver transplantation. What is citrullinemia? Citrullinemia is a rare genetic disorder caused by a deficiency of the enzyme ASS. What are the symptoms of citrullinemia? Symptoms of citrullinemia include high ammonia levels, vomiting, confusion, and liver dysfunction. How is citrullinemia diagnosed? Citrullinemia can be diagnosed through blood and urine tests that measure ammonia and amino acid levels. What is the treatment for citrullinemia? Treatment for citrullinemia involves low-protein diet, medications to remove ammonia, and in some cases, liver transplantation. What is arginosuccinic aciduria? Arginosuccinic aciduria is a rare genetic disorder caused by a deficiency of the enzyme arginosuccinate lyase. What are the symptoms of arginosuccinic aciduria? Symptoms of arginosuccinic aciduria include elevated ammonia levels, intellectual disability, seizures, and liver dysfunction. How is arginosuccinic aciduria diagnosed? Arginosuccinic aciduria can be diagnosed through blood and urine tests that measure ammonia and amino acid levels. What is the treatment for arginosuccinic aciduria? Treatment for arginosuccinic aciduria involves a low-protein diet, medications to remove ammonia, and severe cases include liver transplantation. What is hyperammonemia? Hyperammonemia is a condition characterized by high levels of ammonia in the blood. What are the symptoms of hyperammonemia? Symptoms of hyperammonemia include confusion, lethargy, seizures, and coma. How is hyperammonemia treated? Hyperammonemia is treated by reducing ammonia levels with medications, low-protein diet, and sometimes hemodialysis. What is the prognosis for individuals with urea cycle disorders? The prognosis varies depending on the specific disorder and its severity, but early diagnosis and treatment can improve outcomes. What are the long-term complications of untreated urea cycle disorders? Long-term complications of untreated urea cycle disorders include developmental delays, intellectual disability, and liver damage. What is the role of liver transplantation in treating urea cycle disorders? Liver transplantation can provide a source of functional enzymes and improve the metabolic abnormalities associated with urea cycle disorders. What is the purpose of newborn screening for urea cycle disorders? Newborn screening helps identify infants with urea cycle disorders early, allowing for prompt intervention and treatment. Can adults develop urea cycle disorders? While urea cycle disorders are typically diagnosed in infancy or childhood, they can sometimes present in adulthood. What is the relationship between urea cycle disorders and the ketogenic diet? The ketogenic diet, which is high in fats and low in carbohydrates, can help reduce the production of ammonia in individuals with urea cycle disorders. How does ammonia affect the brain? Excess ammonia can cross the blood-brain barrier and cause neurotoxicity, leading to neurological symptoms and damage. What are the biochemical consequences of urea cycle disorders? Urea cycle disorders lead to the accumulation of ammonia and other toxic metabolites, disruption of amino acid balance, and impaired urea production. What other metabolic pathways are affected by urea cycle disorders? Urea cycle disorders can impact the metabolism for other amino acids and nitrogenous compounds such as glutamine and arginine. Are all the urea cycle disorders equally severe? No, the severity of urea cycle disorders can vary depending on the specific enzyme deficiency and its impact on ammonia metabolism. Can urea cycle disorders be detected prenatally? Yes, prenatal testing can be performed to diagnose urea cycle disorders through techniques such as genetic testing or measuring enzyme activity. What is the role of genetic counseling in urea cycle disorders? Genetic counseling helps families understand the inheritance pattern and risk associated with urea cycle disorders, providing information for family planning and reproductive choices. What research is being conducted to develop new treatments for urea cycle disorders? Research is ongoing to explore gene therapy, enzyme replacement therapy, and pharmacological interventions to improve outcomes for individuals with urea cycle disorders. What are the potential complications of liver transplantation for urea cycle disorders? Complications of transplantation can include rejection, infection, and surgical complications. How does ammonia detoxification occur in non-hepatic tissues? Non-hepatic tissue detoxify ammonia through the synthesis of glutamine, which serves as carrier for ammonia to be transported to the liver for further processing. Can urea cycle disorders affect fertility? Urea cycle disorders can potentially affect fertility as they may disrupt normal reproductive hormone function. Can urea cycle disorders be cured? Currently, there is no definitive cure for urea cycle disorders. However, with proper management, symptoms can be controlled and quality of life can be improved. Are there any preventive measures for urea cycle disorders? While urea cycle disorders cannot be prevented, early diagnosis through the newborn screening and appropriate management can minimize the risk of complications. How does the urea cycle interact with other metabolic pathways? The urea cycle interacts with various metabolic pathways including amino acid metabolism, tricarboxylic acid cycle, and electron transport chain. What happens when the urea cycle is overwhelmed by excessive ammonia? When the urea cycle is overwhelmed, excess ammonia can accumulate in the blood, leading to metabolic acidosis and neurological impairment. Are there any dietary supplements that can support urea cycle function? Some dietary supplements such as arginine or citrulline may be used to support urea cycle function in certain cases of mild enzyme deficiencies. How does protein intake affect urea cycle disorders? In urea cycle disorders, protein intake needs to be carefully managed, and excess protein can increase ammonia production and worsen symptoms. Are urea cycle disorders more common in certain populations or ethnicities? Urea cycle disorders occur in individuals of all ethnicities and are not limited to specific populations. Thank you.